afternoon, everyone. This is Claire Lazaro. I'm the clinical director at Valley Mountain Regional Center. I'm sorry I'm not able to be there with you in person right now, but thanks to technology, I'm able to at least give you a presentation. So, for the clinical update and possibly predicting some trends that could happen in the future, I'm going to be sharing with you what happened in the past 8 months now, basically, with our COVID-19 response, what's happening with the clinics, our intake, and early start. So, with regards to our COVID-19 response, we have released some guidelines to our staff and shared it with our stakeholders and care providers with regards to precautions that should be taken when consumers are out in the community, when they are visiting with families. We have also given some guidelines for our staff on what they can do when they're going to our offices when we started to allow some of them to come back in the offices. Um, we have coordinated isolation or slash quarantine of consumers after discharge or placement. This means that when our consumer is discharged from the hospital or they had an ER visit or from a jail or going from one place, a care home to another care home or from their family home going back to a group setting care home, um, they will be having a 14-day isolation. We call it isolation because we really highly encourage for them to stay in their bedroom, a private bedroom for the next 14 days. But it doesn't mean they cannot go out of their room. It's going to be hard for our consumers to just stay in their bedroom for the next 14 days. And so they are definitely allowed to go out should they wish to go out. They just needed to practice precautions such as wearing masks, or if they cannot tolerate that, as long as they're more than 6 feet away from other consumers in the home, that would be okay. DDS is really wanting to practice extreme caution with our consumers. As we know, most of them have underlying medical conditions, and the fact that they live in a group setting, congregate setting like that, that makes them vulnerable also for severe COVID-19 illness. We do some follow-up also with family homes and SLS. Our nursing staff, especially Angela, has helped a lot with this, making sure that they know the precautions that they have to do, and also if they need PPEs, as well as if they have contacted their medical provider or the public health as needed. We did have several PPE distributions and to our communities with regards to this. We have been updating VMRC as a team, have been updating the community on what's happening with the health advisory, specifically with clinical. The new research, latest studies that I get have been posted on the weekly health advisory, and specifically all related definitely to COVID-19. Also during this time, most of the almost like 90% of VMRC had to work remotely, and so we had to change and start new processes in the intake department and also at early start department so that staff could work remotely at their home. We've also done virtual assessments for the eligibility for our consumers. With regards to our clinics, we continue to have our PT or gait clinic and our sensory OT clinic, augmented auxiliary communication, and durable medical equipment. Those are all still being done. It's also assessment with home and vehicle modifications. Our vendors are doing remote assessments as applicable to each cases, but there are some cases that they need to be there in person and see the consumer in person, so they are doing face-to-face assessment in those cases. they do have PPEs that they use. The modification that happened during COVID-19 is that we don't have the clinics in our offices. We used to have them, one in Modesto and in Stockton, but because of COVID, our offices are closed to the public, so we're not doing that, but it doesn't mean it has stopped. We're still continuing to do that. We have tried to get new vendors and also contractors so as to hasten the process. We do have a long wait list in vehicle modifications specifically and home modifications because of um, limitations on contractor side. But we did try to get more contractors, so we're hoping that in the future it will give some relief on that side. With regards to our telemed psychiatry clinic, we used to have them in the office prior to COVID. It is already a virtual one, but the consumer and the service coordinator and their direct support professional has to go to our office where we have a setup room for that. When COVID hit, they had to shift into some of our psychiatrist vendors initially did telephone consultations. Some of them immediately went into virtual video conferencing, with some using Zoom and some other platforms for virtual video conferencing. So this is still continuing as of now, um, mostly Zoom or other video communication platform. Prior to COVID, also, we've had a dental screening with, we had a volunteer RDHAP help with this, and also our dental coordinator, Carissa. This is on hold right now because of COVID-19, but we have other dental projects in line. For intake, early start, um, autism spectrum disorder, education. So with the increase in demand and referrals prior to COVID, we had to have an intake, a senior intake coordinator. So we have one now that is helping in training and covering all 5 counties. Um, and also training both early start and Lanterman intake coordinators. We hope to hire another one to still cross train on both Lanterman and intake, but still has a specialization in either early start or Lanterman intake. Our coordinator of autism services is continuing to help with the referrals and assessments for autism and also any co-pays that's needed. We also have hired an education specialist that serves as a liaison to our school districts. Our education specialist also helps with ESAIP. Our autism coordinator helps also with the other behavioral services that we have in our regional center. So both of them is kind of like we made sure that they were cross-trained so that if one of them is out, the other person can cover the other. And so for the next 3 years, what are we expecting to happen and what can we think of as possible trends that can happen in the future? One of them is, of course, with COVID here staying within our midst, would be the new normal, kind of like the new normal that we're saying now. We are expected to wear masks whenever we go out of our home, try to practice physical distancing as much as you can, more than 6 feet away. And in our department, clinical department, I foresee that we would continue on following up consumers, calling them when they are discharged from the hospital, whether they live in care homes or independently living with SLS or with their families, just to make sure that they are really safe. And if they have any questions and however we can support them during that time, we'll be able to support them. As I've mentioned before, they are a vulnerable population because they live in group setting. And more so, some of them have underlying medical conditions that make them vulnerable to severe COVID-19. And now with upcoming fall and winter, we are definitely anticipating that we will have the flu virus, the influenza virus, and SARS-CoV-2 virus within our communities. How severe this will affect the communities would really depend on the response of each one of us. Wearing a mask definitely helps. There have been recent studies that the influenza rate last season actually decreased because of people starting to wear masks. So some people have predicted that maybe we'll have a twindemic this time because we have two viruses, flu and SARS-CoV-2. But I'm also thinking it could be the other way around. It could be that we will have lesser cases of influenza and that is if people will be very careful and practice wearing masks at all times. So this is a public health crisis, and that means that your action and my action definitely affects the whole community. Um, I'm also expecting that there would be an increased use of remote and virtual assessments even after maybe next year, even after we have the vaccine for SARS-CoV-2. It is just very helpful and convenient as well to families, those that don't have means to travel but have means to have a smartphone or internet connection. That is one less barrier for them. And those that are having some time constraints, it's also another less barrier for them. So there's a lot of expansion in virtual or remote assessments. I've heard of one research now again in UC Davis Mind Institute, wherein they are really trying to find out how useful the remote virtual assessment for ASD, for autism evaluation, would be in the community, because their initial research for using it in a contrived situation in their center, virtual assessment is really um, is positive, and they have it the result is comparable to a face-to-face assessment. So we can see more of that in the future. um, Right now, we are also going to be doing this. We're in the process actually of doing our new project, the remote oral health support, wherein we're hoping to pilot this, um, wherein there's going to be a device that the consumer will have at their regular care home, and then there's a dental hygienist on the other end who will be able to see their teeth in real time through video and assess them and give recommendations and give education and oral health support to the consumer and also their direct support professionals. So this is one project that I am sharing with you that I'm really excited. And of course, when there is when I guess when what I'm trying to say is when people are more comfortable going back to their doctors, and maybe when there's vaccine and the pandemic has is over, we're expecting an increase in intake referrals. Right now, this has significantly decreased, and this is not just in our area but across the state, because majority of the referrals come from physician offices, and people are scared to go have checkups right now and follow-up visits because of COVID-19. So we're hoping that eventually this will pick up as we go along. Um, and I think that's the end of my presentation. So thank you all so much. And if you have any questions, I'm sorry I cannot answer them live right now with you guys, but you please feel free to email me, clazaro@vmrc.net. Hope you enjoy your day. Bye.